All right. This is the Aspirational Healthcare Employers Group for the month of May. We're glad everybody joining us. I have a good friend of mine that I've known for many years, Jeff Lawhead, who's regional director for Costco Health Solutions, joining us today to talk about what Costco is doing to try to disrupt the healthcare equation. And I could go and talk a lot about Jeff. I won't embarrass him, but he's not only just a really great business person who understands the healthcare industry, but he's one of my mentors and favorite people just in terms of how he does life. So he's somebody that I always love to talk to. He is one of the most gracious, grateful, kind people in business. And it's fun to connect with people like that during your career. So Jeff, thank you so much for being a part of this presentation today. I'm going to run the slides, but I'm going to give Jeff you a chance to just kind of introduce yourself, and then we'll get into your presentation. So Jeff.
Thank you, Daryl, for the gracious introduction, and I hope I can live up to it. And welcome those joining. Certainly look forward to sharing our vision for what Costco Health Solutions is doing to, we think, change the pharmacy benefit management space, which has been broken for many years, candidly. A little bit about myself. I'm a native Southerner. I grew up down on the Gulf Coast in Mobile, Alabama. Been in healthcare my entire career. The first half of it as a consultant with some major national and international brokerage firms. So spent a fair amount of time in health and welfare and managing large benefit plans on behalf of clients. Have been in managed care pharmacy for longer than I'd like to remember, and my gray hair is evidence of that, but about 25 years. So have been with Costco a little bit over 7 years. We're relatively new to the space, 10 plus years, and that's relatively new. But we think we have a different mousetrap, and just delighted to share that with the group today. And again, thank you for joining. I'm a pretty casual guy, so if you want to stop me anywhere throughout this process and drill down, please don't hesitate to do so. I'm going to move quickly through an overview of who we are at Costco Health Solutions at a 30,000 foot level. But I think really where I think we gain is when we share ideas. And so hopefully we could do that. And with that, I'll pause and we can go forward.
And Jeff, before I bring the presentation up, I would love for you to share with the group the Costco philosophy about their employees, because I love the culture that Costco has created. And I remember you telling me about your experience even being hired by Costco. Before we get into the specifics of Costco Health Solutions, I think these employers would love to hear one of the best brands in America and how you treat employees and how you see employees.
Yeah, I'm delighted to do that. I sort of live my life through ethos, pathos, and logos, right? Ethics, logic, and passion. And I have all three of those around the Costco brand. When Costco decided to move out of the Pacific Northwest and take our PBM option national, I was contacted by folks that I've known for years. And I've been around the block. I've been with Cigna, I've been with United Healthcare, been with Optum, the big guys in the industry. And they said, Jeff, you got to talk to these guys. I mean, they are, the passion they have for their employees is exactly what I've heard you say for years. And I thought, yeah, okay, I'll talk. Well, the recruiting process, and for those of you on the employer side, we spend so much time and effort onboarding, bringing folks on board and making sure we have the right team in place. Costco goes above and beyond. I mean, this process went on for a long time. And what they were I think they were more concerned about my belief in the culture than they were how much I knew about, PBM and what they were hiring me to do with benefits. And that really resonated with me. And what still resonates to this day is that Costco, we believe in this sort of inverted triangle, where at the top of that triangle are our associates and our employees. And the theory is if we really recruit correctly, hire the right people, incent them, compensate them, make them feel that they are in fact part of an immense family, that's the first piece of this inverted triangle. Below that is our members, right? We're a subscription-based member model. So if our employees are happy and do a good job and have ethos, pathos, and logos, they're going to take care of our members, which we're profitable on day one of every year because of our memberships. And then lastly, and somewhere down the pecking order comes the stockholders. So this inverted triangle is totally different than what I was ever exposed to in American business. And it translates. So we care deeply about our employees. Our retention rate for our employees is significant after the first 90-day period. And we really focus on that. A large part of what our employees will tell you is that our employee benefit plan and our employee benefit programs not only cause prospective employees to want to interview with us, but they also keep us here. Costco makes it very difficult for us to even listen to anybody else. And I don't know if that's the commercial you were looking for, Daryl, but
no,
in talking to employers, we're a PBM created by an employer for employers. We didn't build this thing to go out and make a bunch of money on Wall Street. We built this thing to support our own employee base. So the culture's real. You feel it every day. And those of you on the employer side know how difficult it is, particularly in today's marketplace. It's really hard to attract, recruit, and retain key people. And when you have an organization that believes in it at the level that we do, that's why we perform at the level we do. So forgive the Costco commercial, but I believe
no, thank you. That's why employers buy benefits, and yet very few ever really truly leverage that investment to attract and retain. And Costco is a great example of a company that's done that. So I'm gonna go ahead and share my screen and start up your PowerPoint, and you let me know.
I'll give you the high sign when it's time to go ahead.
Okay, are you seeing the screen?
I don't see it, Daryl.
Jack, do you see it? You're seeing it? Jeff,
I can see it.
I've got it.
If I got to hit share, I don't see it.
I see it too.
It's right on. I see it.
I can see it.
So Jeff,
View
maybe since you're the only one that can't see it, can you just bring up yours and you just go along with mine, and you just talk through them?
CHS deck. Share. How about that? Do y'all see mine?
Now we're actually seeing yours. So I'm going to turn my, hang on. So we're actually seeing yours now. So yours is working. So I'm going to.
All right, perfect. Good.
Yeah,
Can
we'll
everybody
just
see
let
it?
you go
Are we
through
good to go?
Yeah, I can see it.
All right.
Yeah, we'll just let you run because you're.
I'll run. I'll run with it. I'm driving. Okay, good. So Costco Health Solutions, we are totally owned, 100% operated by and managed through Costco Wholesale. I would suspect many of you on the call today have a Costco card in your wallet. I certainly hope you do. We're 45 years in business. Annual revenue last year was in excess of 216 billion. We operate, we call them warehouses, not stores, but we operate 583 of them across the United States, including Puerto Rico. We employ 304, that's probably more like 307,000 employees. I'm most proud of the fact that we're repeatedly honored with respect to one of the best places to work, and our employees say that. And largely that's because of our benefits package. We have a significant number of employees covered by Costco Health Solutions, my organization. And again, last year we were named by Forbes as one of the best employers in the world. And again, forgive the commercial, but having been with some of the larger healthcare organizations in the country, I can tell you this is the finest place I've ever worked for, and it's pathos, logos, ethos. I keep saying it. So about us at Costco Health Solutions, we've been in operation for about 10 years. We cover almost 300 million lives, or 3 million lives now. At the time this slide was prepared, we're about 2.5, but we're having an outstanding new business season this year, bringing on new clients. We own and operate 3 of our own mail order facilities, as well as 3 of our own specialty pharmacy facilities, 2 of which are west of the Mississippi, 1 of which is east of the Mississippi. We are based, Costco that is, in Issaquah, Washington, outside of Seattle. And that's kind of where our PBM grew up, in the Pacific Northwest. We've got 65,000 network providers, which looks like those of you who are intimately familiar with PBM, we're pushing the same buttons and pulling the same levers. We've got the same network that you would be familiar with your current program. We manage and run our own internal formulary management. We've got, at this juncture, around 30 clinicians who are dedicated specifically to our pharmacy benefit management operation. A couple of years ago, we bought a minority interest in an organization called Navitus. We own about 33% of Navitus. We have 2 board seats with Navitus, and we purchased them in part as a result of the fact that we utilize their claims platform. Costco's always been an organization that when we can more effectively build something, we choose to do it. But in this particular case, we partnered with Navitus, bought a significant yet minority share in them, and we utilized their claims platform instead of building it ourselves. They also provide a partnering arrangement with us on federal programs such as EGWIP, employer group waiver programs. Some of you may have those already in place. We negotiate our own rebates. We're part of a rebate coalition cooperative, which aggregates the ability to deal with manufacturers for incented cost and reimbursement around rebates. We currently have in excess of 1,000 clients, and if you're self-funded, we'd be delighted to talk with you. We don't have a minimum. So if an employer group is self-funded, we'd be delighted. But we have experience with small groups from 50 lives all the way up to 375,000, which is our own employee group. Our client retention is outstanding, as is our satisfaction. We run a manufacturer's coupon program through pharma and pass 100% through at no cost. Also have patient assistance programs, which we run through an organization called RX Valet. So very robust PBM, and I've given you that at a glance. I'll go quickly here. Some notable accounts for us. We're involved in municipalities, agriculture, unions, Native American tribes. I list Diamond Pets here. They're one of our first clients, and they were a Costco supplier. They make all of our Kirkland signature pet foods, and they're out in the middle of nowhere. And these guys have been with us since day one. And if we ever get to the stage where any of you would like to speak with a client that has seen us grow and seen them grow and see their cost reduce, they're significant advocates on our behalf. So this is a little bit of a snapshot of our notable clients. Target markets, obviously employer groups. We deal with labor. Third-party administrators are part of who we target. We have some coalition business, Native American tribes, also work with captives. So we look pretty much in terms of market space, like most other pharmacy benefit managers do, but the majority of our business is with what we would refer to as the middle market employer group, which I would call 500 employees up to 5,000 employees. So that's our wheelhouse. That's where our real strength is. The piece that I think really begins to differentiate us is that as an employer-based PBM, we were built internally to manage our own employee group. So we understand retention, we understand turnover, we understand the role that benefits play. And all of you from an employer base today, you all struggle with the same things we do. And that's why we, fortunately had our own size, scope, and scale that we could build our own PBM. We didn't have to buy it. Our service levels are incredible. And what we do in the marketplace for our clients is the same thing that we do for ourselves. The other thing that I'll point out is because we own our own pharmacies, we're buying, this year we'll buy about $4.5 billion worth of drugs. So for our own pharmacies, so we have significant insight into what this stuff ought to cost. We also own and operate our own pharmacies, which again gives us total insight into how an employee benefit plan around the pharmaceutical benefit ought to work. And I touched on it a little bit, but why did we enter the space? Candidly, our board got very disgusted. We didn't think that our PBM vendors were aligned with us. The service levels were inconsistent with Costco standards, which are very high. And at the time, Dr. Ben Carson, who later came onto our board, but still consults with us, we got a bunch of pharmacies on staff, and basically the board said, why the heck don't we build this thing ourselves? And Costco's, for the most part, been a build it, not buy it company. So that's what we did. We built this thing. And we're fully transparent. Everything passes through. The same value proposition that we run for our own employee group is the same thing that we would discuss with any of you should we have a conversation around perhaps creating some sort of PBM partnership. So we test drove this whole thing with our own employees. And if you know anything about Costco, we're very paternalistic in terms of dealing with our own employees. So we're not going to bring anything to the marketplace that we haven't already test driven, if you will, with our own employees. So that really, really separates us from what's in the marketplace. And I'll pause real quick and see if anybody has any questions or comments thus far.
Are you going to get into specialty drugs and kind of what you've done to manage those, Jeff?
Yeah, I can a little bit. It's pretty complex, but again, we run our own specialty program, and I'll touch on that here in a second, Daryl.
Okay.
Jeff, you talk about you're transparent, and yet you talked about some of the rebates. Isn't that a kind of dual aspect where most of the transparents just basically do a pass through with the rebates to their clients? My understanding.
Great question, and you nailed it. And I hate, transparency is overused, and I'm probably going to redo this slide because I'm tired of talking about it, frankly. In our world, what transparency means is whatever we get from pharma, we're going to pass through 100%, all of it. We don't retain any of it. Most of my competitors retain a portion of a rebate, or they utilize spread. And what I mean by spread is they'll go out and contract with retail pharmacies and retail pharmacy chains at one rate, and they'll charge the plan sponsor another rate higher, and they'll keep the spread. So when we say we're transparent, whatever we get from pharma is exactly what our clients get. And whatever we contract for, with those chains that are outside the Costco footprint is exactly what we're going to charge our clients. So, no spread, no retention of rebates. Our sole source of revenue, with the exception of the margin on the drug, is what our administration fee is, and we'll put that in writing and guarantee it. You can audit us monthly if you'd like. Most PBMs will tell you can audit once a year. It's a terribly laborious process. It's extremely costly for the plan sponsor. We're passing it all through. We're totally agnostic about rebates. We don't chase rebates in our formulary because we're not keeping any of it. So our whole approach is we want to drive to the lowest net cost. And I think it was a great question. I hope I answered it with respect to rebates.
Thanks, Jeff.
Yep. So at the end of the day, again, differentiating how we're different, we manage our own plan, and we built our PBM to manage a plan for our own employees, not to take it to the marketplace. So we've test driven everything we're doing with our own employees before we ever bring it to the market. When we say we're focused on employees and employers, we are. We're not owned by a health plan. When I got into the PBM space, pharmacy benefit managers operated pretty autonomously and contracted with large health plans. Now the large health plans have all aligned, and many of them, and I talk about the Cigna ESI Express Scripts relationship, now they're all bringing it in-house and bundling. It's very hard to understand where the costs are. So we're built by employer for employer, and that really, really differentiates us. We have experience. We have a high deductible health program ourselves as one of our options. Because we're managing our own spend, obviously our eyes are on fraud, waste, and abuse. Our full 100% pass-through model is in fact pass-through. I'll guarantee that our only source of revenue is our administration fee. In my prior life, generally a PBM contract was 60, 70, 80 pages, plus multiple addendums that a Pennsylvania lawyer really couldn't figure out. Our contract with addendums is 17 pages. If you've been in the benefits space for 6 months, you could probably read it and understand it. And we're particularly proud of that. We don't charge for any clinical programs. I call them junk fees. We don't charge for prior authorizations, on and on and on. What the administration fee is what our clients see from us, that and the claim cost, and that's what we do. So it's a very, very clean, straightforward program. This is just a little bit of a testament. When we fully transitioned 100% of our employee plan from sort of an unbundled approach where we first did mail, then we did specialty, then we did full PBM. We made the full transition to Costco Health Solutions in 2018. And you can see that for 2022, our overall cost to Mother Costco was significantly less than what we were paying to our vendors in 2018. So needless to say, Craig Jelinek, our CEO, Richard Galante, our CFO, that sit in the corner office, they're delighted with CHS. So we've proven that you can, in fact, run your own program and you can do it more efficiently. And that's the purpose of this slide. And how do we do it? It's pure drug selection. And I mentioned before, most PBMs will populate their formulary or their PDL, prescription drug list, with branded agents that generate high rebates. And they do it specifically because they're capturing a portion of those rebates. Because we're agnostic toward those rebates, we could care less. We're going to create a strategy that drives to the lowest net cost while still providing the opportunity for our clients who come on board to grandfather any existing formulary. In fact, I almost always recommend, at a minimum, a 90-day transition with the existing formulary to minimize disruption during the implementation, and just absolutely strategically make it easy for that plan to move over. And then we'll begin to put in more cost control pieces, deal with specialty pharmacy programs that we believe save significant amount of money, and we'll do that over time. We don't try to do that and create disruption up front. But how do we do this? It's all based on drug selection, and that's where we really focus, and that's what differentiates us. As I mentioned, we have our own clinical management team that runs the whole show for us. We onboard and have very, very hands-on with respect to clinical management. Our specialty approach, I think, is second to none. We will appoint a clinical account manager as well as a specialty pharmacist around our specialty outreach. And when I talk about specialty drugs, I'm talking primarily about injectables. I'm talking about oncology. I'm talking about drugs that typically are taken by those who probably have 2 or 3 or 4 other comorbidities. So they're the highest cost drugs, and very often the smallest number of patients that are utilizing them, but now make up a significant portion of pharmacy spend. So we put a tremendous amount of emphasis on clinical management as it relates to specialty medications. And most of the 2 boxes there, the blue boxes on the right, those would typically be specialty drugs. And those of you that are involved in the management of pharmacy benefit plans probably know a little bit about what I'm talking about here. But if you don't have your arms around specialty in today's environment, that's where your spend's going to be. So,
And Jeff, just to put that in, I think I want to underline that, if I can interrupt you for just a second.
sure.
Tell me what the percent of total spend on healthcare is pharmaceuticals. Is it about 20%? Is that right? Am I thinking about that
And
right?
rising, we see sometimes as much as 40, Daryl.
Really? But
it's all mixed. It's all utilization. It's
but
all
of that 20,
some of it's regional. Some of it's
of that-
regional.
of that 20 to 30% of the total healthcare spend that's medicine, what is specialty drugs now getting up to? Isn't it about half?
Yes, almost 40%.
So if you look at something that's 30% half, that's 15% of the entire healthcare spend is on these little tiny few people that are being prescribed specialty drugs. So it's like, this is a huge opportunity to maximize the healthcare system, to spend less if you can manage it well. I just wanted to put that in perspective.
Yeah, and I think the important thing to note here is you don't do that with a mail campaign.
Yeah.
Right. I mean, you can't. We call it lettering people. You can't letter people and help them to manage clinically these highly expensive, difficult drugs. Many of these people, when they're first prescribed an injectable, a self-injectable, they don't know how to do it. It's scary. So, many docs will just say, well, we'll send you to an infusion clinic, right? They'll all do it right there. They'll inject it there. Well, where do you think the cost goes? Right through the roof. So we found that hands-on, one-on-one management, and, if Jeff needs a specialty medication, pharmacist Susan is going to be the one who he talks to every single time. And so it's not like I'm being transferred off or handed off. It's somebody different every time. It's a very hands-on, did you get your stuff? Some of it has to be refrigerated. Some of it can be sent directly to the home. Others have to be sent perhaps to an infusion clinic. So it's a very complex delivery system, but if not managed correctly, can absolutely blow up the spend within a health plan. And particularly, I don't know, let's look at a 500 to 1,000 member group. You can have 4 or 5 people who can blow that spend right out of the water. And there's no way we can plan for it. It's not episodic like blood pressure medication or statin. There's no way to plan. And so you got to have this, what we believe is strong clinical management to get your arms around it. And we feel like we do a heck of a job there. And again, test driven through our own employees. You have 300,000 employees. You're going to see everything in one of those boxes right there we've seen with our own employee group.
Yeah. What is the highest cost drug right now? Isn't it like $2 million?
Oh, I don't know. I could Google it right now, but there'd be another one tomorrow or the next day.
It's crazy. There are some drugs that are just crazy expensive.
Yep.
Okay, go ahead.
It's a deep subject, and anybody that wants to drill down further, we have a whole dedicated team of specialty management experts that are PharmDs, registered pharmacists, medical directors, and clinicians who can speak to it in much greater clinical depth than I'm comfortable with. But we have our arms around this, and I'm very confident in saying to the group today that we do a heck of a job in this area. So anybody that wants to drill down deeper, ping Daryl, ping me, we'll set something up. We'll do a one-on-one with you if you want to talk about clinical management around specialty drugs. These are a couple case studies. This was a group that came on in 2015, and the bar chart on the left, you can see their PMPM, which is per member per month cost, was bumping up in the high 60 PMPM. In 2021, we cut that thing in half. And how are we doing it? We're doing it with drug selection primarily. We're doing it with appropriate management. We're doing it with clinical intervention. Next case study is a labor group, 1,000 employees. These guys started with us last year. And 1 year in, we've had significant savings. And I won't go into all the clinical things that we did here, but this is pretty typical. The first one here, I point out as a larger group, it's about 2,600, but even on 1,000 belly buttons, we generally will see a 25 to 30% savings year over year in year one, and it's pure drug selection. One thing we do that seems simplistic, I think, on the surface, but we find is very, very meaningful, and our clients tell us the same. When we put a team together for our clients, it's the same team from day one that implements the group, that performs the clinical piece, that ensures a smooth transition, and then manages the account downstream. So every other PBM I've been with, it's different people. So you're constantly handing off people, and you're not able to create a relationship. And I think many of y'all can probably relate to the fact that, it's a lot of employers don't have huge teams of people. And when you're constantly changing the folks that they have to deal with, their jobs are big enough. It's not just managing a pharmacy plan or a benefits plan. They got payroll, they got retention, they got hiring, they got a whole lot of jobs. And the last thing they need is a change in teams. So we think this is pretty big. We get high marks for this. The other thing we do when we onboard a group is we give our clients some insight into who these folks are. We give them a chance to meet and make sure that the fit is right. If you need bilingual people, we certainly can accomplish that. So we take this really seriously, and I'm very proud of this, and I know back at Mother Costco, we're proud of this as well. So, the operation of the plan is only part of it. We want to drive to low net cost, but we want to do it with the right relationships. So lastly, we feel like we do the best job that I've seen, and our clients tell us that we manage and balance the needs of the employer and the benefit better than any PBM they've ever seen. I have to believe that's because we built this thing for our own employees. We didn't build it for Wall Street. We built it for our own employees. We're really good at interfacing with the medical community. And it's not a secret, I'll share with you, our ASO carrier is Aetna. And pretty much anything that, and we put them through the ringer, just like every other employer does on renewal. But pretty much anything you're going to see as an employer, we've probably seen it as a result of the number of folks that we're taking care of. And we continue to leverage our own understanding of the pharmaceutical industry. Not many PBMs can say that. CVS Caremark, obviously, Caremark operates the CVS model. But the level of insight we have in terms of how much something should cost is directly as a result of what I mentioned, the close to $4 billion that we're buying for our own account every year. So all in all, we think we've got a model that fits for those folks who are interested in really driving to low net cost. We do it for our own employee groups, and we'd be delighted in having introductory conversations with anybody to sort of share how we're doing it. Delighted to be a resource. Sometimes we're not a fit, and if we're not, that doesn't mean that we can't continually share information and figure out how to disrupt this thing and fix it. So that's, in my relationship with Daryl, that's the thing that's always impressed me, is that really what we're trying to do is we're trying to change this. We're trying to change healthcare for the better. And, experience has taught us that these 3 check marks, in our belief, is how you do this. So thanks for your time. I'll pause and delighted to
let's open
respond.
it up for some discussions. And thanks for emphasizing that this is a unique situation. Here you have one of the largest employers in the world who's having to manage benefits for their own employees and has said, we're going to disrupt this pharmacy area of healthcare because we need it, and we're going to share our disruption with others. I'd like to, Jeff, maybe before we open it up to too many questions, I'd like to share with the group what you're doing for your members through your Costco discount pharmacy program. I've got that up on my screen, and if you want to stop sharing yours, or I'll just take over and share mine. I want the people to understand about how any member of Costco, which is probably most of the people on this call, can benefit from your purchasing power. So you may not be able to see it, Jeff, but I think everybody else will see it. So I'm going to move over to the Costco membership prescription program. So when I discovered this a number of years ago, and I'm on a cash type healthcare program, I was like, okay, this is cool. I'm a member of Costco, and because I'm a member of Costco, I can buy drugs at a considerably less cost because Costco is willing to share that with me, just like their own employees. So, Jeff, you want to talk just a little bit about that Costco program?
Sure. So we call it CMPP. It's the Costco Member Prescription Program. You got to be a Costco member to utilize it. But as things stand today, that costs you $5 a month, $60 a year. The program essentially is our cash price, UNC price, and generally, rarely will some other retailer be able to offer this at a level below ours. And I constantly bring in the $1.50 hot dog and the Coke into my conversations, and people laugh at me. Well, Jeff, what the heck does that have to do with pharmaceutical benefits? Well, we hadn't changed that $1.50 hot dog or that Coke price for 35 years. So why can we sell drugs at the level we do? Because we're making money on $1.50 hot dogs. We're making money on toilet paper. We're making money on, water. We're making money on margin on our gasoline. We didn't create CHS or the Costco member prescription program as anything other than a benefit for our members, which is how we are so profitable. It's what we do. It's ethos, logos, pathos. So what the Costco membership program does is allow somebody who's got that card in their wallet to go up to the pharmacy counter. If you've got medical insurance, that's fine. It can't copay, but very often I tell people, unless they're, take a look at what the cash price is going to be. Obviously, you want it to count to your deductible, et cetera, if you've got coverage. But for those who are cash paying members, Daryl, this is an extreme benefit. It also extends to pet medications. It extends to vaccines. Costco Health Solutions also has oversight over vision and hearing. So there's a whole lot of benefits through our CMPP program that a lot of people just aren't aware of. The only downside, if it is a downside, is you got to be a Costco member to utilize it. It's also available at, I think we've got about 22,000 other retail pharmacies that aren't Costco's where you can also utilize the program.
Well, if I could interrupt you, I just brought up on my screen, I just put in a particular.
I can't see it.
Yeah, but just everybody else can. I brought up atorvastatin, and I'm showing here that for the particular, you can set it at different strengths and package and quantity and stuff, but for a 90, which is probably a 3-month prescription.
Yeah, 90 days would be a 3-month prescription.
Yeah, so the Costco pharmacy is $16.79. If you were to have it home delivered, it's $18.79. But if you're not where you can get to a Costco or don't want to use their home, they have contracted with other pharmacies, like I'm showing at Walgreens. So you can use your Costco member discount program card to get that from Walgreens at $35.79. Now, I don't know why you'd want to spend twice as much, but the point is it doesn't always have to be through Costco's pharmacy. The program extends to, like you said, about 22,000 other pharmacies.
Yeah, probably almost 30,000 now.
Yeah.
So we continue to, the issue is they won't give us the rates that we want. And so if they don't, they're not in the program.
So, extreme savings. And again, even if you're on an insurance plan and you walk up to the Costco pharmacy and you say, hey, figure out what my copay is, but also tell me what it would cost me if I just pay you cash through the Costco membership discount program. And a lot of times you'll find that you're going to spend less on just buying it with cash through the Costco membership discount program than your copay. So it doesn't hurt to always ask.
So did I hear Jeff say that you're a Costco member, you're a card carrying Costco member, and I have been for a long time. And does that give you access to this, or that's an additional program that you?
No, no additional.
No, it comes with a membership. The point I should have emphasized is you're not filling anything out. There's not an enrollment process. There's not a member card. There's not a separate BIN or PCN. Your Costco card, your Costco card is your passport to the savings. You walk in, you throw it down on the card. Back at if you've been at a Costco, all of our pharmacies are at the back. We do it purposely, so we make you walk through and buy all that other stuff before you get to the pharmacy. But that's it. It's such a sweet, easy program. And if you're in a donut hole, if you got a high deductible health plan, of course you want that to count toward the deductible. But if you're on maintenance meds, you may never get there anyway. So it's still a heck of a benefit. And it's we utilize it in some industries, particularly hospitality, where generally there's a really in many hospitality organizations, there's a longer waiting period before the whatever the benefit program actually kicks in. And it's very often cheaper for that employer to go ahead and buy the Costco membership at $60 a year, $5 a month. You know, they got a 90-day, or they got maybe a 6-month waiting period. And we've had a lot of hotel chains, we've had a lot of restaurant chains who see this as a really viable way to help their employers, you know, in that piece. And I don't know how much that applies to anybody on the phone, but there's lots of applications for it.
Yep. So other questions. So I want to make sure those of you that are on the call get a chance to ask Jeff. What questions do you have? I'm going to stop sharing.
I can just give a qualified thumbs up for not only Costco, but also that we have a couple of clients that actually use the Costco PBM.
Do you?
Yep. And they've, in fact, it was non-negotiable when we're talking about healthcare on the healthcare side. I mean, because of the fact that what you shared is obvious that they like the program, they've enjoyed the program, and it works wonderfully, Jeff. So I applaud you for that.
Thank you.
My question is, since the space in the PBM has come alive, what about healthcare? What about the other side of the fence? Have you guys looked at that option, since you certainly have a captured audience?
It's
Jeff
been a
and I talk
large
about this all the
time. Let me respond, Daryl. I can't tell you how many conversations Daryl and I have had around this. It's a huge passion of mine. We've watched with what Walmart's doing. They're doing it primarily in more rural environments. We have 8 of those here in Georgia where I sit. I sit outside of Atlanta, a small town called Noonan, Georgia. And we're watching very closely. We're well aware of how many folks have that Costco card in their wallet. We sell tires, we sell cars, we sell vacations. All of those things are part of the Costco membership, and the loyalty level is extreme. We're watching very closely. And the one thing that I share with folks is, when we evaluate a business that we're going to get into, we essentially take a square foot in a warehouse and create a revenue stream around that. And this even applies to healthcare. Can we make any money with these outbuildings doing this? Understanding that the loyalty that we have would go a long ways. The second piece that always gets thrown back at me by our senior leadership team is the demographic of our member generally is heavily college educated, a minimum income of generally $125,000 to $150,000. We're not certain. We have a lot of entrepreneurs, but what I continually get put back in my face is we don't know how many of our members really, might want to go down this road. Now, having said that, we're having significant conversations around some of the sharing programs like Daryl's working with. And, to say that we're not paying close attention would not be accurate. But it's a continual discussion. Our senior leadership team is all over it. And when we enter into it, we want to do it the correct way, the right way, with the right partner. So I'm not being evasive in the answer. We're still kicking tires.
Well, Daryl would know my reasoning for say that, obviously, is in the fact that in the space that you are with your own employees, and that's what I was more referring to. When you're talking 307,000 employees, and you're in the insurance business, you're in the food business or selling in a warehouse business, but you're really in the insurance business with healthcare as a self-funded employer. And one of the things I found is that even as former hospital guys, as Daryl and I are, they're some of the largest employers in all of a given market, the hospitals, and yet they outsource their own healthcare to the carriers, which I have a hard time understanding. When you are talking about an employer, I will tell you, in the Ozarks where I am in Springfield, when Costco opened just a year and a half ago here, in the heart of Walmartsville here, I mean, Arkansas is right down the block, and
Well, I've been to Bentonville many times
so
in a former life.
so the aspect is that it was a relief for a lot of people in a way, because it was an alternative, and it carved a niche, and that's what you guys have done. You've carved a niche, and so we were able to use our Las Vegas, Nevada Costco card in our new membership here in Springfield in our home. The point I'm making, however, is the fact that what you've done and the passion you've done with your PBM on that side, and the tried and true opportunity came because the 304,000 people started with it. Literally, that's where you started with the model, if I understood correctly.
Yes.
So you permeated from there. Well, I still think that that's an opportunity, and I think Daryl and I would love to talk to you about a couple of solutions on that side, to be perfectly honest. I just wanted to throw that in there, Jeff.
Thanks, Jack. Anybody else have any questions for Jeff before we close up? Jeff Ellington, you've always got a question or two. Austin, Greg, Lisa, do you have any questions?
So I had texted to Jeff earlier that it sounds like if there's a local pharmacy, that people love to go to, you can always, could we ask for them to be included? Because sometimes they might be able to, come close to.
So is your question, can pharmacies that aren't currently included be included? Is that what your question?
Price or whatever, but is there any specific criteria you?
I think if I may.
I think I got the gist.
Daryl?
Yeah.
Yeah.
If they want to.
There's a credentialing
And
process.
is there certain?
Jeff, you're kind of scattered. You're coming in and going out. So I'm going to let Jeff Lawhead go ahead and answer your question, Jeff.
Yeah, and let me back up a minute. Early in my managed care pharmacy days,
For deciding whether to include additional independent pharmacies.
Thanks, Jeff. Yeah, go ahead, Jeff Lawhead.
yeah, I spent a number of years with a pharmacy advocacy group that focused on community-based and independent pharmacy. I have a huge heart for that. Those people have been disenfranchised by the big PBMs. We take a totally different approach to inclusion. We have a very rigorous credentialing program involved. The problem that an independent has is that they can't accept those deeper rates. However, we recognize that particularly in a rural environment, we operate and run a rural network. So I think if I could hear Jeff correctly, is it possible for an independent or a community-based pharmacist who might not be in our network to be included? Absolutely. If there's a credentialing process in place, we recognize the place for independent and community-based pharmacy. And again, that goes back to how we believe and what we believe. So yeah, our network probably looks like most other PBM networks, although I would think that particularly in more rural areas, I would guess that our community-based and independent numbers might be a little higher. And again, we do a lot of Indian service work in more rural areas where that community-based pharmacy in a rural environment is extremely important, and we recognize the need for that. So I can't broadly answer, but yeah, I mean, we'll go through the credentialing process. Anybody who desires to do so.
Nice. Okay, we just have a couple more minutes. I want to open it up and see if anybody else has a question before I kind of close things up. Anybody have a quick question for Jeff? Not seeing any. Jeff, thank you again. You've always been so gracious and participating in our conferences and our groups. Thank you very much. We've already had some people text that this has been extremely valuable, and I'm going to be sharing it, the recording. Yes, we are going to share the recording so others can listen to it. I will mention that our next meeting is going to be on June 2nd. So that'll be our Aspirational Healthcare Employers Group. And we're going to kind of further today's discussion around this idea that benefits are a huge investment in attracting and retaining top talent. And a lot of employers are not really leveraging the money they're spending on buying health benefits to do that. And we have a specialist in the recruitment area who's going to be joining us and talking about how valuable, effective, and relationship-based benefits are at not only attracting employees, but retaining employees. So would welcome and I invite everyone to join us again next month on June 2nd as we explore this idea of retention and attracting employees. Again, thanks, Jeff, and we'll sign off and
Thank you,
everyone.
Daryl. Thanks, everybody, and happy Cinco de Mayo. Go frequent your local Mexican joint and eat a taco and enchilada for me.
Thank
Thanks
you
for
very
bringing
much.
that up. That's
Be
great.
well, everybody.
Okay,
Godspeed.
take care. Bye now.